Hello, everyone. My name is Antu Hossain, and I am the Global Health Impact Officer here at CanWatch, the Canadian Partnership for Women and Children's Health. And one second. And my pronouns are she and her. I'd like to welcome you all to this space today. Thank you all for taking the time to join us for this learning opportunity that we have entitled Understanding Gender Equality Through Mixed Methods. For me, home is Toronto, or known as Toronto, and I am grateful for the stewards of the land who have made it possible for a settler like myself to live, work, and learn on the traditional lands of the Haudenosaunee, the Wendat, and most recently, the Mississaugas of the Credit. So guided by our members, CanWatch found a gap in measurement innovation. We wanted to conceive a space to tackle the challenges of process, partnerships, and really build room for creative thinking and problem solving with respect to data, monitoring, and evaluation. As such, the Canadian Collaborative for Global Health was initiated by CanWatch with the generous support from Global Affairs Canada. 6 different labs or project teams of diverse partnerships across academic, research, civil society, and implementation partners embarked on an investigative inquiry to address urgent data challenges in global health and gender equality. All labs included an academic and civil society partner to strengthen the mutual capacity of their learnings. 2 of these labs, I'm really excited to say, are joining us here today as part of this critical dialogue. And as you can see in the next slide, Tina, thank you. As you can see in the next slide, their valuable work encompasses multiple global partnerships and the strengths of them. We'll be leveraging their expertise and knowledge to have a broader discussion on best practices and opportunities for mixed methods approaches. So, if it's too bold to say, I believe that many of us on this call are here today because we believe in the value of mixed methods. We believe that it is an effective way of not only understanding the what, but also the why. And so with that, we want to furthermore dive into how to strategize and balance options for mixed methods. What are more of the practical considerations? What are drivers and opportunities? And so within an hour, we probably can't get into all of the details, but we do want to share some practical examples for your reflection. We very much encourage you to consider this a two-way dialogue. Please feel free to ask questions in the chat box throughout the webinar. We will be having, after the presentations, an opportunity for the audience to be having their questions answered. So with that, you will be able to raise your hand using that raise hand feature and unmute yourself. However, again, questions are welcome throughout the webinar. So this webinar is being recorded, and the recording will be shared on our website in a week's time. If you're having any technical difficulties, please connect with Tina La Rochelle, who is entitled Technical Support. And so without further ado, let me introduce our amazing panelists today. So we will have first Elsabe du Plessis. She is a postdoctoral fellow at the Institute for Global Public Health at the University of Manitoba. In this capacity, she has coordinated and led the Adolescent Sexual and Reproductive Health Lab under the Canadian Collaborative for Global Health. Her global health projects are primarily in East Africa, conducting qualitative research. She will be followed by Alison Riddle, a PhD candidate in the School of Epidemiology and Public Health at the University of Ottawa, and a research associate at the Bruyère Research Institute. Alison has 20 plus years of experience in the fields of gender equality, women's empowerment, and global health. Then we will have Rudy Broers, who is the Director of Monitoring and Evaluation at Plant International Canada. And last but definitely not least, we will have Mark Urasa, who is a demographer by profession and a senior research scientist with the National Institute for Medical Research based in Tanzania in the Mwanza branch. Since 1994, Mark has been leading the old cohort study in Africa named Kisesa. All right, so let us move on to the presentations. Over to you, Elsabe.
Thank you, Antu. Next slide, please. So as Antu said, my name is Elsabe du Plessis. And today my job is really just to set the stage for the rest of the presentation. So I might not be saying something new to the audience today, but I'm hoping to get us all on the same footing as we move forward. Next slide, please. So what I'm sharing today is based on what we learned and some of the challenges we faced as part of our lab, as Antu mentioned. I was the coordinator and one of the leads. Dr. Thies Burma, who was our PI, is also on the call, I believe, as is Mark and Rudy. And what I want to share today is not a comprehensive overview of methodology, be it quantitative, qualitative, or mixed methods. We just don't have the time for that. But I really want to talk about the process we went through in selecting our methodologies and some of the lessons learned, as I said, and some of the decisions we made along the way. Next slide, please. So in our lab, we used multiple methods to determine what we could learn by collecting data in these different ways. And then a question we dealt with from the beginning is how do we integrate these different methodologies and the findings at the end to balance the different strengths and weaknesses of the methodologies and maximize what we could learn from the data collected. And this is really a central characteristic of mixed methods research, is that it's integrated from the beginning, and that everything from your planning, your objectives, sampling, to how you write up the findings has element of your quantitative and your qualitative methods in there. And it's not separate studies that happen to be conducted in the same population at the same time on more or less the same topic. And it's this aspect of integration that often is challenging. Next slide, please. This brings us then to the question of which methods do you select, which do you use? And really whether you're going to use a monomethod approach to your research or a mixed methods approach, this comes down to selecting the method that best answers the question you need answered. So the first step would really be determining what you really need to know based on your project's objectives and the topic areas you're trying to cover, but also what your purpose is at that particular point in time. Is this for program targeting to define success or monitoring progress? Mixed methods is a good fit often for the initial baseline assessment and formative research, since it gives you an idea of the breadth and the depth of the situation. And this is really when mixed methods is a good fit. When your topic is relatively unknown and you want to find out more about it, when it's something that is difficult to measure with quantitative measures alone, like complex social processes or social contexts, or in our case, when you're interested not only in the scope of the health behaviors, but also in the beliefs, values, and motivations that underlie these and the social context within which it takes place. So once you've sort of determined what you need to know, and then from there moved on to your indicators and your more direct questions, you can determine which data is the best fit for your question. Quantitative is good for certain questions, qualitative is good for certain questions. And I think that is an aspect that often gets lost in the quantitative-qualitative debate, or the so-called paradigm wars, is that one isn't inherently better than the other, is that they serve different purposes, they have different strengths and weaknesses, and bring different aspects of your topic to the fore. And these are some of the decisions that you can then think through and decide whether a mono method is best, quantitative or qualitative, or whether you really need a mixed methods approach. Now, in an ideal world, after you've come to this point, this will be how you select your methods. But we don't live in an ideal world, and in reality, there are a lot of other considerations to think through. This whole slide is a very, very simplified and abbreviated representation of the process, obviously, of decision-making. And this list of considerations is also a very abbreviated version of some of the decisions we had to make in our project. But things like thinking about your target population. Are these younger adolescents that may not be able to learn, to read, or are these older adolescents? For us, privacy and confidentiality was a big concern, and so that influenced how we picked the methods. What resources are available, not just in terms of budget and time, but also what kind of human resources and skill sets do you have? What is already known? Who is your audience? Donors, policymakers, others may prefer one kind of knowledge to another. So what does that mean for how you select your methods? And in the end, how you weigh the different findings when you bring them together. And what is feasible in this context? Is this a context where it's okay for adolescents to walk around and to move around and ask questions about sensitive topics? Or is this a rural area where you have to consider distances traveled, or whether you have access to Wi-Fi or electricity, all of these kinds of considerations. And it's really in this column today that I think most of our presentations are going to focus, and where we see a lot of challenges. And then after you've sort of done that, you can move on to the data collection, specific methodologies. And I've just listed some of the ones we used, as you saw on the previous slide, that built on our considerations and our decisions. And it's really just about being explicit about these decisions and documenting them. And so I'm going to pass it over to Alison to talk about one of these considerations in terms of selecting measures that already exist that might help you get the knowledge you need.
Thanks, Elsabe. I'm just going to share my screen, or try to. Well, maybe we'll just continue if you still have my slides. Ah, you did it. Perfect. Apologies, guys. So as Elsabe mentioned, I'm going to talk a little bit about, I'm a quantitative researcher, and my research focuses on quantitative measures of women and adolescent girls' empowerment. So I thought we'd talk a bit about, how do you select valid measures for complex constructs, and how do you know if you're measuring what you think you are? So I think sometimes folks think that the quantitative measures are the easy ones, right? But in fact, it can be quite complicated, especially if you're talking about complex constructs like empowerment. And actually, qualitative research can play a really big role in terms of the creation of validated quantitative measures. And so one of the things that we want to think about when we're selecting quantitative measures is, how do we actually know that we're using valid and reliable measures? So what is a valid measure? So a valid measure actually assesses, validity assesses if a measure is actually capturing what it is intended to capture. So it's about accuracy. Are you measuring what you think you're measuring? And the ways that you know if you have a validated measure, there's a bunch of different ways. I want to focus on two in particular. So content validity really looks at whether or not what you're measuring accurately captures the content of the construct. So you really need to have a clear definition of what you're trying to measure, so that you can then see, by looking at theory and using expert input, to see if you're really actually capturing the whole essence of the construct. And then construct validity looks at the accuracy of the measures, and you can actually use some statistical tests to look at those, such as confirmatory factor analysis. In terms of just a side note on reliability, so while validity looks at the accuracy, are you measuring what you mean to? Reliability is it consistent? Are you measuring it consistently across time, people, scenarios? And so a measure can be reliable, but not necessarily valid, right? You could be measuring the same thing over different situations, but it's not actually what you want to be measuring. Whereas when you do have a valid measure, they're almost always or very frequently thought to be reliable. There's also criterion validity and face validity. Criterion validity is where you actually compare what you're measuring to a gold standard that exists for that particular construct. That can be quite hard to do because they often don't exist. And face validity is like content and construct validity, but it's a much more informal process where you just sort of look on a face value, is it actually measuring what you think it's measuring? So how do I find a validated measure? This is a question that I get asked a lot. Similar to Elsabe, I'm going to give you an easy 5-step process, which is very far from easy. So obviously the first one is always, you really have to clearly define your construct. So what are you trying to measure? So let's say household decision-making among women. What does that look like in the context? And what are the questions you want to understand around household decision-making? Is it joint decision-making? Is it women have sole decision-making over particular areas of their lives? Like, you really have to figure out, is it for example, decision-making on major household purchases, or is it decision-making on healthcare for oneself? And what is actually meaningful in the context that you're working in? So you really have to get clear on that. And then from there, there's a lot out there in terms of existing validated measures. So you really want to, and I'm focusing here on looking for existing ones, because the idea of creating your own measures is quite an involved process. So the idea here is to really try to leverage what's already out there and what's been validated, and that also allows for cross comparability between contexts, which can really be useful. So you want to conduct a literature review. And that literature review is looking for those validated measures. And once you have that list, in terms of how you select a measure, you want to look at sort of 3 ideas in terms of how that measure was developed. So first of all, did they use formative research to actually influence how they designed it? Did they use existing theory and practice? Did they maybe test these out, pilot test them and use formative research in terms of cognitive interviews to make sure that they're actually a valid measure? And then you want to look at psychometric testing. And that's where we look at measures for reliability and validity. Did they do any psychometric testing? Did they use a confirmatory factor analysis to look at whether or not all the items that are included, say perhaps in an index, are actually all highly correlated and are measuring the same thing? Did they look at inter-rater reliability in terms of looking at external reliability? So when 2 different people use that measure, did they get basically the same results? So these are some of the things you want to look at. You also want to think about, has this measure been used in your population of interest? So that could be geographically. So if you're looking to do a study in East Africa, have these measures been used in East Africa? But then also, is it in your population group? Is it just in adult women? This is very common for empowerment. Or what about adolescents, single adolescents, young adolescents? Does it mean the same thing? In most cases, not. So you've got to look for ones that are for your population. You can also adapt the measure. But that, again, I've put that in brackets because that's a whole can of worms that if you can avoid going down is probably a good idea. It takes a lot of time and investment. And then you should always, as we know, pilot test the indicators that you're using to make sure they're actually, again, valid in your context. So I know Rudy's going to talk a bit about this next. So the Women's and Girls Empowerment Index, as an example, that Plan International uses, looks at 5 domains and a series of subdomains. And I've taken one section here around the domain of participation and decision making, which has 2 subdomains. And I'm just going to focus here on household decision making. So they want to understand, looking for measures around household decision making, level of involvement in decisions. And you note that a lot of these can be customized to the sector. So like I said, is it around healthcare? Is it around who accesses education? What food is eaten, etc. So these are some of the indicators that they're using. So I was thinking, okay, well, how would I go and look for validated measures that are from that? And I often go to the Emerge website. So that is, apologies, out of UC San Diego, where they're actually cataloging and assessing quantitative measures for gender equality and women's empowerment. And this is one example from Medema's 2018 paper and how they've been assessed. So the indicators actually on the left here are actually from the demographic and health surveys, but they've used them to create an empowerment index for East Africa. And on the right, you can see how they were assessed. And again, they looked at the things that I was talking about. So what formative research did they use? So they used existing literature and theoretical framework. You can see the key down here. So that's green. These others were not assessed. Reliability. So it looks like they got partial points for internal reliability, and inter-rater was not used. So test, retest is, again, that multiple times. So you do the test once, you do it again, and it's another way of assessing external reliability. And then validity, they actually did quite a bit, because I know they did a split half sample with confirmatory factor analysis. And so they did look at content, face, and construct. And again, not surprisingly, they didn't use criterion, a gold standard, because it doesn't really exist for household decision making. And what you can't see on the screen is this is for women of reproductive age 15 to 49. So if I was looking to understand household decision making in terms of money, healthcare, major household purchases, or visits to family and relatives, I would consider using these from the DHS because they are validated and have been used in a wide variety of contexts. So I'm going to stop here, and I know Rudy's going to continue, but I'd really be interested to hear everybody's experiences in terms of selecting validated measures for your complex constructs and your questions that you might have for us. Thanks.
Thanks, Allison. I hope everybody can hear me okay. And maybe just a reminder, I know Jessica is encouraging people to put questions in the question box, and I already see a reference here to weighting on indicators. I'll let Allison opine perhaps a bit later on that weighting question, but I will raise it here now as I talk a little bit about some of our experiences, practical experiences here on our WEG, our Women and Girls Empowerment Index. Just as a way of background, and I know many of you will be familiar with it, we have shared it in other fora in the past with regards to Plan International's through CanWatch, the sharing of the Women and Girls Empowerment Index. We were really looking here at the basis on gender transformative programming, and we know that it's multifaceted. We know that we have expected changes across different domains. We tried to think through these domains in a way maybe slightly different than other indices that we had captured in the past. And it is very much a living document as we think through new innovations and reflections. And I think what Elsabe and Allison are also alluding to is the importance of checking in, of validating, and of course of not solely relying on getting answers from quantitative surveys, but also finding those moments where qualitative helps to add nuance of the why and the what, and not just the what, but the why as well. Next slide, please. We had created these 5 domains. You see them here on the right, and what access control, roles and responsibilities, decision making, social norms, and duty bearers helps us do is categorize indicators across these 5 domains, helps us understand the nuancing of our programming across these important areas. We think the question around weighting is a really interesting one, one that I think across our current use of the Women and Girls Empowerment Index is still one that's being tested and discussed a great deal. And really the weighting, it goes back perhaps to Elsabe's point about where is the depth and the intensity of programming, and how are you selecting the relevant questions and sectoral indicators across each of your domains. And of course, really correctly reflecting the programming that you're carrying out with your partners. So the emphasis or weighting currently is not something that we've set in stone, and it's something that again we are testing, reflecting on, and really are hoping that these kinds of sessions help us better understand where we're going with it, right? So I think by and large it helps us understand and ensure that we're covering all 5 of our domains in our programming. and it is a way that Plan International thinks about these domains. It's been adapted. I know there are other types of indices out there, but this is quite unique to Plan Canada. Even Plan International has taken on board many aspects, but incorporates others as well. And you know, nomenclature may change, but there are certainly other indices that are quite similar. So perhaps next slide, I can highlight a couple of interesting questions, and I apologize if this is a bit slow or a bit small on the screen. One of the things I think that Alison highlights really well, and it shows here, it's really around the correlation across questions. A great example of how closely aligned many of these questions are that are asked in a particular context. And we know that these questions and the understanding of programming, this one is particularly related around health facilities and health personnel. You see here how high and how correlated many of the questions that I've outlined here below are to each other. You can see the details added here. And I think in a proper discussion back to Alison and what she has professed, we do need to look at correlation of questions, whether each of these questions are so highly correlated that we can simplify what we are learning from this. On the other hand, are we looking at programming that is already, or are we looking at a situation that's already well advanced in terms of the perceptions of this of these health facilities? Let me add another thing. You know, the nuances here around this kind of questionnaire is useful, but again, does it really get us into the why? And here I would say the mixed methods comes back into play. The importance to dig a little bit deeper with adolescent girls and adult of both age cohorts, as well as adolescent boys, in understanding and digging a little deeper through qualitative methods and regular check-ins on this. Now, this applies right from the outset of your project design through implementation, monitoring, and final evaluation. So if we are finding that there's other ways of approaching this that gives us greater variance and greater interesting findings on progress, I think that's an important insight and an important validation of mixed methods. So we all understand that that the change in social norms on programming is extremely difficult, and it is challenging to find change. It's also challenging to find ways and talk about validity. To Alison's point, a very large proportion of the questions which we have developed are based on existing tools, many of them from DHS and other sources. So to partially answer the question that's just been raised there, it is incumbent upon us to adopt and adapt questions that are pre-existing and place them within the relevant domain in the area that we're working. But these are examples of questions that have worked really well. But what they do is they deal with underlying understanding or perhaps some preconceptions, and they do help us understand and show a good deal of variance. And under social norms, they have worked. These types of questions have worked well in the past. Let me move on to another domain, access and control. Here's another example, another area. This gets into some element of decision making, but you see the types of responses here that have functioned well, but are highly time consuming. And require a good deal of reflection on the way the questions are posed, asking all of the sub questions and getting yes, no, or no response, or offering open-ended type questions that allow for some time and reflection on response. Here again, I'd underline that while these have worked and do work, the challenge is time, resources, and again the question of mixed methods. Can we tackle this in a more efficient way? Can we get to the why a little bit more in some of these questions through mixed methods? And what can we learn eventually from validity of questions and whether these are demonstrating again the kind of change that we want to see in our programming. That's not an identifier of a question working well. We may not see any change in some types of questions, and it may be an indication of the lack of depth in programming in some areas, or the time it takes to achieve change in our programming environment. So social norms is a good example. Gender-based violence is another example where we often see a surprisingly high level of acceptance of gender-based violence among men and women across even across an entire programming cycle. Does that mean the questions are invalid? These tend to be well-known and tested questions used in DHS DHS surveys and others. Excuse me. So the question therefore becomes about depth of programming, but also going back to Elsabe's point about mixed methods. What else can we do to understand the change happening in acceptance of gender-based violence without using those types of survey questions, because we risk of not seeing the nuance and the change across over time that we'd like to see. So then it goes back to mixed methods. It goes back to other ways of reaching an understanding on issues of gender-based violence. And perhaps one more example here on decision-making that perhaps many of you have come across, and I think, Alison, you allude to questions that we have found where decision-making questions which have been asked in the past, especially of younger cohorts of adolescents, very high deferral to parents on final decisions. So even in questions that we think, and this is to Alison's point, that questions that have worked and have been used in other situations, situationally, or perhaps correctly, there is an understanding that these types of decisions, and this is SRHR related for adolescents, these types of questions often defer to the parent in the context in where we work. This again, very high levels here where parents are making final decisions on these kinds of issues, and once again bring up the importance of the points that Elsabe and Alison are underlying around the types of tools which work in the context, but also keeping in mind that these tools may be insufficient to monitor some of the change happening and the nuanced change happening in our programming, because we understand that in these contexts and under the circumstances, and this may be especially evident for the younger cohorts of adolescents, that you get these kinds of findings which help to understand whether the tools are very useful in programming or less useful for helping understand, or insufficient and require additional methods. And I'll say that on a couple of scenario-based questions which we have used in the past, we had very high rate of positive response, and not a great deal of success. I'd be happy to hear other examples that anyone else has had with these types of scenario-based questions. But in our case, in a couple of different instances, they have revealed very high positive response, and were not particularly helpful. So let me summarize before turning over to Mark. I think this added some examples here to think about in terms of challenges, in terms of lessons on indicator and question validity, in question of workload and financial outlay, but also reflection again on how we can get to the nuances of our programming by not just relying on some of these quantitative elements, but also integrating some qualitative sources as well. And with that, I'll hand over to Mark for the next session of the slide.
Okay, thank you, Rod. Okay, I will continue from where Elsabe ended, and I will present our experience working in Mwanza and Sumbawanga, I would suggest that if somebody will want to do it elsewhere, would have to do some changes and the adaptations. So here I'm presenting on the requirement for implementing mixed methods. In Mwanza, we did adolescent survey, facility survey, qualitative approaches, as Elsabe presented, analysis of sexual behavior of adolescents 15 to 19 years, and also we did a qualitative study synthesis for the studies which have been done in northwestern Tanzania. One of the important requirements for doing the mixed method is to have an institution, a sort of stable institution, could be private, NGO, which will lead the implementation of the activities. And of course, you also need a proper research infrastructure. So for our case here, it was the Manitoba University and the National Institute for Medical Research, Mwanza Center. So this is crucial to coordinate the implementation of different research methods. And also you need to have financial resources. But the amount of the finance you will need depends on the size of the study. Of course, in the area where the study will be implemented, you probably will need long distance traveling. So definitely you will need to budget for that. Also very important that you will have the right personnel with right expertise. You will have researchers like data managers, statisticians for the analysis, research assistants for supporting data collection. You will have transcribers, especially for the qualitative data, as well as translators, because in many cases, the data will be collected in local language. In our case, it was Swahili, so we had to translate into English as well. But also you need to have equipment for data collection. Like for our case, you need computers, you need tablets for the data collection in the field. For example, for the ACAS, we use the tablet to collect the data. And also very important to have the area, to have decided the area where you will be implementing your study, where once you select them or you set the criteria for picking them, you will train them, and you have to identify the training venue. We did work in the health facilities, so you have to identify the health facilities and of course do the right processing of requesting for permission to work in the health facilities. And of course, in terms of the area, this area must have your targeted population. In our case, it was adolescent 15 to 19 years, both boys and girls. And definitely we did the qualitative and also did the quantitative, the adolescent survey and the facility survey. Next slide, please. Also, you need to consider issue of transportation. So if you have big group, then you will have several vehicles. If a smaller group, then you will have fewer vehicles. And also the type of vehicle is important to consider. If you will have long travel, like when we traveled from Mwanza to Sumbawanga, it was like 1,500 kilometer going and 1,500 kilometers coming back. So another requirement for implementing the mixing method is to have enough time. The developing the tool, translating them, putting them into Akasi, it takes a lot of time, and as well as the qualitative tools also, they need a lot of time to prepare. So one should consider having enough time to process these tools before the start of the field work. Of course, like for example, Elsabe had to stay for like 3 months continuously to make sure we had the tools completed, or the process of preparing the both qualitative and quantitative tools done. Of course, again, you need to have competent peer researchers whom you will train. Of course, you will not allow them to go to the field to interview fellow peers before you are sure that they are competent, because you will not be there when they are interviewing their fellow peers. Most important is to do a pilot where you see how they asking the questions on the varied topics. Again, you need thorough documentation of the entire process from the beginning to the end, and this is very, very important. Because it will help you when writing the reports and doing the analysis and writing the papers. In our case, we did a lot of documentation, including learning experience of the adolescents who took part in the adolescent survey, as well as the peer researchers. Next slide, please. Now, from our experience, we think the mixing method is very beneficial because it allows verification of reporting from different sources. In our case, there was reporting from the health facilities, reporting from the qualitative interviews, and also reporting from the adolescents. And also we had analysis of secondary data to determine sexual behavior of the adolescent 15 to 19 years. So we could see what what is being reported from different sources on a certain variable, for example, sexual experience. Also, the mixed method allows for triangulation analysis to be done, which is very, very important. And we think once we do our triangulation analysis, I think we will have very, very strong output to inform everyone. And also mixed method make findings more concrete, because the findings are coming from different sources, and you can make references. And also I will say that I would recommend this approach for others with some adaptations, because definitely Mwanza is different from elsewhere, and I recommend the method, but with some changes and the adaptations, and also depending on what resources someone has. Next slide, please. Well, I should also say something on the limitation. The mixed method cannot be easily implemented in an environment without research infrastructure. So someone trying to do this in a place without research infrastructure will need to spare enough time to be able to create even a temporal research infrastructure to help him or her implement the mixed method approach. And also, one other limitation is that some of the activities, like the interviews and other things, we didn't have direct control. Like we didn't have control of the session between the PRs and their fellow peers. And also for the ACAS, no control or means of verifying what the adolescent were self-reporting in the course of reporting the ACAS. Those are few limitations, which, however, they are very, very few, and its implication is minimal in terms of what we are getting from use of the mixed research methods. I think this is my last slide. Thanks a lot for listening.
Thank you so much. And we can pause on the slide sharing for now. But I think this was a really rich set of presentations, as we can see from a lot of the questions we have in the chat box. So let me just dive on in. So Allison, this was an earlier question, but in your Women Empowerment Index, do you have a different weighting for every indicator?
Oh, I actually think that was for Rudy. In Plan's Empowerment Index. So why don't I let Rudy answer that one? Am I right, Rudy?
No, I was going to let you answer, Allison.
Okay.
No,
so on the issue of weighting generally, I can answer.
Sure. Yeah.
So so there's a couple things, like my own opinions and my experiences when it comes to measuring empowerment. I'm not really, so I don't use composite measures where you sort of weight independently and develop weights. I tend to use exploratory structural equation modeling that does weight it according to factor loading. So it is a way of weighting, but it's not one where I would go in and manually add the weights. I think it really depends on the context, right? Like I was thinking about this as you were talking, Rudy, about how to select, where to put the emphasis and weighting, those sorts of things. I think it really starts, especially for empowerment, and I apologize, this is my sort of lens that I see everything, is really when you take that step back and you do a gender-based analysis first, right? That really helps you understand what are the levers you want to pull on in terms of addressing gender-related barriers or gender transform things that need to happen to address gender-related barriers, either to health or to actually change underlying gender relations through a transformative approach. So for me, it's always like, okay, do that, see which levers you want to pull, and then those would be the ones that I would be focusing on to measure as part of a program. I'm not saying that you wouldn't. I think the plan one has a good cover of many of the important domains. But for me, when you really got to focus and you have limited resources, I think that would help me narrow it down. I also think T's comments are really good about the need for fewer indicators and really focusing on and reducing them, and there's statistical ways that you can go about that to make it a little bit more focused. So it's not a direct answer on weighting. It's that's my fuzzy one.
All I'd add to that is I think that's subject to I mean, again, more analysis, more work to understand, but also from us, it really has to do with the intensity of programming. Where do we feel the intensity of the programming is, and where are we investing in depth of programming? And we should be thinking about weights that identify that, because we understand that, as great as any index is, any composite is, it's a reflection. It has to reflect where the programming environment is, and has to end up being somewhat instructive.
Yeah.
And beyond that, then we go to looking at other methods to unpack some of the other points that are there around change, but which may not be captured necessarily in that sort of piece. So I think everybody likes to see a final product in saying this is Plan International Canada's Women and Girls Empowerment Index. It's not a finished product by any stretch. And I think, Alison and I have already, and Elsabe and others, we've already talked about, how do we take this further, this learning from the collaborative, and also the discussions which are relevant and very informative around resources, time it takes to do surveys. Again, Tisa's point, how to remove questions that may not be required, but still allow for understanding of the depth of programming.
Well, great. I think in many ways, we've been touching on the question of item reduction and the comment that we've had there. So the comment was, fewer questions for the index are better than more questions if the measurement gains are marginal. Item reduction testing can help reduce the number of questions. So because it was a really fulsome comment, Tis, you're free to unmute yourself if you would like, but I also invite others like Elsabe and Mark to comment. So Tis, it seems like you're unmuted. I'll let you.
Sorry, thanks, Antu. Just two other points. I think, first of all, I really like mixed methods. I think they're really powerful in a difficult area like gender and empowerment. We need to use both. I would keep the surveys as simple as possible. And for instance, not include too many why questions, because why questions in surveys generally don't work very well, whereas qualitative methods, such as the peer-led research, are really great. Just two questions. Do we have experience with vignettes? Because that's something that has been pushed big time at some point in time, then it went down. Is this something, and I know in Monza, Mark and Elsabe have also worked with it, is that something to get new insights? And the other point I wanted to ask also the speakers is language. Because in English, we have so many words and so on. I'm struggling with it all the time. We did a global study or work on accountability. A common English word like accountability. Many languages don't have a word for accountability, and that changes your whole perspective. So in gender, do we also spend enough time on these language issues? And Mark, you probably struggle with it in Swahili, or as the local population uses Sukuma. It's something that we tend to skate over perhaps a little too easily in this area. Thanks.
I think, Alison, you have your hand raised, so I'll let you speak first, and then Elsabe and Mark, if you'd like to chime in.
Yeah, I don't want to jump on the others. I was actually thinking about, it's a good question about language, and that's where in the validation process, you do cognitive interviewing, which is even before you pilot test, where you take a very small sample and you ask people the survey questions, and then you do a whole sort of a cognitive interview of, what do you think this question means? How did you answer it? Da, 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 da. So it's part of that validity question. And languages tends to be a huge issue. And one of the reasons that we also do adaptation, right, of surveys is often for language. And that idea of needing to do forward and backward translation and doing cognitive interviews to make sure it's actually landing where it's supposed to land. But I was also thinking about the vignettes, and that's coming up more and more. In the gender research. So again, I'm quantitative, but I've been looking a lot into how do you measure agency, for example, and the different components of agency. And the idea of using vignettes has been coming up more and more to actually delve into things like self-efficacy and self-esteem. And that tends to be recommended more, but I don't have experience using them. So I don't know if others do and can share.
Elsabe, I'd love for you to comment on the vignette question, but as well, we've received a question around how can you please talk about any approaches, and this is to Elsabe as well as other speakers, but can you talk about any approaches that apply to understanding gender that is outside of the male and female binary? how might this be related to any observations you've heard with respect to the local language question as well?
Yeah, first, just to comment on the language issue, I agree with Thies. I think it's one that is very important. And because the preparation phase or the lead up phase to implement the survey is often so long, it is one that sort of gets rushed and that we don't spend enough time on. And I agree completely. Or I've seen people use a survey that was previously translated into Swahili, but in Kenya, where it's very different than in Tanzania. So I agree that's something that we need to definitely spend more time on and think through how we phrase questions and how questions is asked. In terms of the vignettes, I think for us, they seem to work very well, especially the ones that asked about attitudes towards gender and gender nonconformity. I know Rudy mentioned that they got that they found social desirability bias to be quite high with those questions. But for us, it lined up much better with what we got from the qualitative, or fit better with the sort of gender division of social life that we saw in the qualitative transcripts than the questions about decision making and gender that we had in the survey. So questions like who was the decision maker about marriage? You know, lots of girls would say, oh no, I decided. But then when you look at how they describe the roles of the different partners in their relationships according to the vignette, or in the peer research, it's still very much men are dominant and get to tell us and make the decisions sort of perspective. So I thought the vignettes actually brought out very interesting dimensions of gender. And I think I'd mentioned this before when I was talking to Alison, Rudy, and Mark. It's just, it highlights this idea that gender is dynamic and a more complicated construct than we can usually capture with a few questions in a survey. And it really deserves a little bit more time and the insights that we can get from qualitative. And I would say that's my answer to the non-binary question as well. I think that is an area where mixed methods is essential, or is a very good fit, because it is one that is difficult to approach in many contexts. It's one that we may not capture with the questions in a survey, and where different kinds of qualitative methods can provide insight, not just the peer research we did, but we can think about doing a media analysis or doing document analysis, looking at other sources of data that can help us understand what the gendered context is and how someone who's non-conforming or non-binary might fit within that. So what their social experience would be. So I would say it would be a very good fit for that kind of question. Thanks.
I'd just like to ask Mark this question particularly, but anyone else jump in. Do you ensure that you are only with the women or girl during the interviews? For example, you have 2 interviews, 1 male and 1 female. Who will do the interviews separately to ensure freedom in the woman's response? So does the gender of the interviewer matter? Mark, do you have any comments around that?
Muted, yeah. So in our work in Mwanza, we were very, very much gender sensitive, and both in the quantitative and in qualitative, we had equal numbers of girls and boys, and always boys will interview boys and girls will interview girls. Yeah.
That's a really succinct answer to that.
I just want to add to that, sorry, where we did do interviews in group settings, because we did do the Akasi by bringing the groups together. We always made sure that there were research assistants of both genders there to help answer questions. We thought it was important, but it may also be socially context dependent, because I have seen literature that says that that actually doesn't make a difference. It depends on how people view gender relationships in that particular setting. But we definitely stuck to that, and we thought it was important and made a difference.
Well, thank you all so much. I know that there are a lot of really insightful comments and questions in the chat box. If I could get the last slide, Tina, up on the screen. I want to share another upcoming learning opportunity. If you enjoyed this one, is in the chat box. Feel free to register for our next collaborative critical dialogue led by the collaboratives. And as well, if you want to be notified of other upcoming events with respect to the dissemination of the lab's work, please sign up at the link there. The next slide as well, please, Tina. So really, I know that I'm unfortunately cutting this conversation that is really rich short, but we knew this would happen. Mixed methods is a very loaded conversation, but I hope that many of you, thanks to all these amazing panelists, have taken away some practical considerations of what opportunities may be existing for your work in mixed methods. Please feel free to email them individually and follow up with any questions that you may not have had answered. And really just a very generous thank you to all the panelists for taking their time, sharing their insights, but as well as all the participants for taking your time today to be part of this learning opportunity. We also generously want to thank Global Affairs Canada for this opportunity to host the Canadian Collaborative for Global Health, and hope that in many ways you all have seen the benefit of the learnings that have come out of the labs. So with that, thank you all, and thank you all for joining us, and we hope to see you again soon.
Thank you, Antu. Okay. Thanks everybody.
Thank you. As well, okay. The recording and slides will be available, so that you will see in your inboxes as well. Thank you, everyone.
Thank you.
Thanks a lot. Cheers.
Cheers.